What you're seeing this afternoon is the part of the East Carolina Heart Institute, which is, we're now in the operating room at Pitt County Memorial Hospital and the new heart hospital. The new heart hospital is associated with the East Carolina Heart Institute. This is a $150 million project to bring the latest cardiovascular disease therapy to Eastern North Carolina and North Carolina in general. The other part of the Heart Institute is the University part, East Carolina University part, which is funded by the people of North Carolina, and that's education, clinics, and research. What you see here in this operating room is the highest of technology. We're not just operating through big incisions anymore. We're operating through small incisions, robotically. We're using catheters to determine the best way to treat patients. We're putting valves in the future with catheters rather than opening the chest. And what you see here is a hospital that's equipped to provide the latest in monitoring for surgeons, cardiologists, vascular surgeons, general heart surgery, all types of surgery. And also, this part of the hospital is designed especially for patient care. You're not seeing a patient care room here, but these rooms that we have in this new 120-bed facility are designed for patients and their families. You may ask why we have multiple monitors in this room. The type of surgery we do today is really a team approach. You say, well, wasn't it a team approach in the past? Absolutely it was. But this is different. We're doing small incisions. We're operating so you can't see what's going on. So now with these monitors, everyone in the room can see exactly what's going on. The person running the heart-lung machine, the person doing anesthesia, the circulating nurse, and you work with lockstep synchrony. It's a new way of doing things because we're doing things more and more minimally invasive.
What kinds of things will happen right here in this room?
In this room, you'll see wonderful things. You'll see things like Henry Carter said when he opened King Tut's tomb, magical things. You'll see robotic cardiac surgery, operating on valves through tiny, tiny incisions, totally done endoscopically. You'll see the new generation of percutaneous valves where you put them in via the femoral vessels instead of opening the chest or from the apex of the heart. Perhaps you'll see gene therapy in another 15 years. But you're going to see everything that's related to the highest in technology. Remember, I travel the world. So it's not just what is good in North Carolina, it's what's good in Leipzig, it's what's good in Tokyo, it's what's good in New York, the Cleveland Clinic. We have something that is just as good and today is better than many of those places. You're standing in the epicenter of cardiovascular diseases for the United States. In other words, if North Carolina were considered, were ranked with the other states, we'd be pretty much down near the bottom as far as survivability for cardiovascular diseases. Eastern North Carolina is a whole paradigm shift from that. We'd be the last, if we were a state, we'd be number 50. In other words, we have one of the highest incidence of cardiovascular diseases. That means high blood pressure, diabetes, stroke, coronary artery disease, valvular heart disease, rheumatic disease, congenital heart disease. Taking these together, it is a real mandate for the people to get it fixed. This is only the beginning. And you can say, well, how can this just be the beginning? Always look at things in the future. And the notion, if you heard my speech this afternoon, the speech related to basically a multidisciplinary way of giving patient care. So that you're focused just on the patient. In other words, you're not just going to the cardiologist who may say, well, let's dilate the artery without talking to the surgeon, or the surgeon says operate on the artery without talking to the cardiologist. It's a way that you look at evidence-based medicine. What is the best outcome? What are the data? We know we did this and we got this result nationally. So therefore, let's apply it to our patients, whether it's surgery or whether it's medicine. We have an epidemic of obesity. We have an epidemic of people who don't exercise, people who have untreated high blood pressure, who don't go to the doctor. When have you been to the doctor? Probably not very often, okay? So you wait sort of until the disease is manifest. And so this is a rural area. Tobacco was big business at that time. People like barbecue, all the good things. If you all lay that on a genetic predisposition, you get these disease processes. So the idea is to unlayer each of this and determine exactly what's causing these problems and try to peel back this through prevention, research, and therapy.
You mentioned in your speech that you're going to be handling the cases differently than in the past.
Well, this is what you do. We've designed in the medical school component, and you saw the other building, the East Carolina University component, where all clinics are integrated. In other words, the doctor's offices, you may have a cardiologist right beside a surgeon. Rather than the surgeon's tucked over here and the cardiologist eating their lunch together, you will have these people integrated, working together, so that, you know, difficult cases, straightforward operations and things would go down an algorithm. We know, you know, we have solid evidence that if you do PCI or angioplasty or surgery, they would go down that algorithm. But if there are people now who have multi-factor disease and they also have multiple comorbidities, and they have strokes, kidney failure, all these things on top of heart disease, those are the ones you discuss in conferences. What's best for the patient? Well, why don't you operate on it? Well, because being on the heart-lung machine with bad kidneys may put this patient on dialysis. So let's try to treat this patient medically, followed by percutaneous therapy. And if we have to operate on them, we will. It will probably cause dialysis to the patient. So, you know, you're discussing it across a number of specialists. Well, I would hope that people would think that it has already become one of the premier centers. If you look at robotics and cardiac surgery, you would realize that we lead the international group in the number of mitral valve repairs. We started all this using robotics. But having said that, you know, I'm quite biased. I think the facilities will allow us to do this integrative approach. There are very few centers in the United States that are using this integrated approach. And those that have done it are very successful.